well, everybody passed. And we were all like, ah! Like, she was looking at us like, oh my gosh, did you guys think you were going to fail? But hi, Sonogang. Welcome back to my channel. I am Reese, the Sono Mom. I had to go on like a week or 2 week long hiatus. After finals, I don't even know. I don't even know. Um, anyway, I managed to finish the semester with a 4.0. When I say I can't believe it, I mean it. I can't believe it. Like, in vascular, I got an A by the skin of my teeth. I got the lowest A I could possibly get, but it's an A. In echo, I got a pretty high A, and in clinical, I did get a pretty high A. So I am so proud. I worked super hard. What was different about final exams than the quizzes or the midterms? I think that final exams makes you apply your knowledge. In my program, you have quizzes that are 25 questions, and they're all fill in the blank with no word bank. You have to spell everything correct. You have to know the word. That is just that. The hard thing about quizzes is that, especially for vascular, there was a lot of content, over 400 slides worth of content per quiz, and you weren't even sure what was going to be on the quiz, so you had to just know everything, and 25 questions were chosen from that. Midterms were difficult. I got a 90, which is a B, where I am. It was difficult because it was our first multiple choice, but because it's multiple choice, the questions kind of made you think deeper, but some of the questions were similar to what was on the quiz, except you had options, so it made it not so bad. The final exam, it was like, I don't even know how to explain it, but it's like on the quiz you would learn directly about flow in an artery, right? Um, where there is stenosis, velocity increases. Okay, you think that's all you need to know. But then on the final exam, it's like, I don't know. I don't even know an example, but it'll make you apply that knowledge where you're like, okay, well, I know it increases, but does that mean that the pressure is going to decrease? Like, it's just like something that makes you think past what you thought you had to know, and that sometimes can be a little bit stressful. Almost everybody after the final exam was like, that was the hardest test we've ever taken in our life, and we were moping and sobbing, and thank you goodness that our instructor graded it within like maybe 15 minutes after the last person finished their exam. And before she handed them back, she just says, well, everybody passed. And we were all like, ah! Like, she was looking at us like, oh my gosh, did you guys think you were going to fail? But yes, we did, because it was just a difficult test to take, and it's nerve-wracking, but whatever, we all passed, all 11 of us. We started out with 12, one dropped during the summer, and so far all 11 of us are moving on to the next stage. The next semester will be our last semester as first years. I'm so excited and so nervous at the same time. That brings me around to what our semester is going to look like. I know a lot of you guys were having questions about schedules, and I can only tell you mine. Every program is going to differ, but our first semester was just one class, Intro to Patient Care. The semester I just finished, we had echocardiography, vascular, and a clinical, and this is for cardiovascular. DMS is a little bit different. They had gyno, they had abdomen, and they had OB, and then they had clinical. So they had one more class than us this semester. Next semester, I will have EKG, ultrasound physics, which is our first board exam test, echocardiography 2, vascular 2, and a clinical. And this time we have to do our scan exams on actual patients, which is like, ooh, it's getting real. Excuse me. I'm not 100% sure what DMS has to do. Maybe I'll ask and fill you guys in once I figure that out. But this semester was pretty difficult, so adding 2 more classes is a little bit scary, but I feel like we have a 97% pass rate. Almost everyone has done it, so I can do it too. No one said it was going to be easy, but what they did say is it was going to be worth it, so I'm ready for the worth it part. I plan to go in about once a week to practice to make sure that I still can keep up on my scanning skills. We are out of school for about 6 weeks. I took off this week. Next week I will be starting to go with my classmates because, like I said, our first year in clinical, all we had to do as our comps, which are like hands-on exams basically, was to get the patient from the exam room, introduce ourselves, get their 2 identifiers, medical history, explain the exam, all of that. And then we would have the tech that was observing fill out our scores. And that's all we basically had to do other than observing and getting some scan minutes. Even if we didn't know what we were scanning for, we had to get some scan minutes. Next semester, it's real deal. So whatever views that a real tech would get in the heart or a vascular tech would get in the leg or upper extremity, we have to have at least one of those images and then get graded on that. So I can just say it's going to get a little more intense. You guys can let me know whatever you want to see or know about. I don't want to just continue talking if you guys don't really not care for, but it's not necessarily what you want to hear, you know? But I just want to fill you in on how that went, how next semester is about to go. I'm going to enjoy this break, y'all. I needed it, okay? I need it and I need it. Of course, I'll keep you guys updated. If you guys let me know of anything else you want to know, I will also fit time in to make a video for that. I try to answer all comments, and I really appreciate you guys, Sonogang. I don't know. I think that is all for now. Thank you guys for being so patient with me, for being so encouraging. I needed it. There was no way I could have gotten that 4.0 without you guys. It was a process. Happy holidays and have a fabulous day. Smile forever, even if you get B's or C's for real, y'all, because I was humbled this semester. B's or C's, we still pass. Okay? Love y'all. Later.